I'm Russ Jaffe, the host for this webinar. I'm a physician and internist, clinical pathologist, a biochemist, and a certified clinical nutritionist. I maintain a fellow's scientific status in the American Society of Clinical Pathology, the American College of Nutrition, the American College of Allergy, Asthma, and Immunology, the Federation of Clinical Immunology Societies, and I'm a fellow of the American Medical Laboratory Immunologists, as well as an overseas fellow of the Royal Society of Medicine. I'm a scientific fellow at the Health Studies Collegium, and I am founder and director of PERC Integrative Health and ELISA Act Biotechnologies. Well, what are migraine headaches and how do they differ from other headaches? Well, first of all, migraines are different than just your run-of-the-mill headache. Migraines are characterized by a throbbing pain. It's usually asymptomatic. It's usually not all over the brain or all over the head, but in one part. It often hampers daily activities. It lasts a while, typically 4 hours to several days, with or without treatment. About 10% of Americans are found to have migraine headaches from time to time, with a predominance of women over men. Comorbidities for headaches are quite legion, and they include epilepsy, depression, asthma, anxiety, stroke, maldigestion, senility. In other words, anything where the balance of the body is off, any time when the distress is greater than the eustress, any time when the biological system, the brain and the body are pushed to or beyond their adaptive limits, then irritation and a consequence of migraine headaches may be one of the consequences. A little more about migraines and their symptoms. As I indicated, the pain is intense. It increases with physical activity and movement. It pulsates, it throbs, it radiates. There may or may not be nausea or vomiting, sensitivity to light, sensitivity to sound. Some people find that it's even too overstimulating, even painful to open the eyes. And so that's why a very low sensory environment, typically with minimal to no light, minimal to no sound, so that the body can readapt itself to a healthy equilibrium. Now here's a high-tech way of documenting that visual auras really do happen. On the top of this slide, what you see are serial functional MRI, magnetic resonance imaging images, each of a sagittal or halfway section of the brain. And what you see over time is that this electrical overexcitation continues for a period of time, much longer than it would in a healthy person. And the bottom line is that if you have visual auras associated with your migraine, there is an electrochemical wave that moves across the brain visual cortex. And if you actually want to document that with a functional MRI, a number of groups, research groups, have been able to do that. So we now have physical documentation that while migraines are in your head, they're not just in your head, they are physiologic and biochemical, as well as attitudinal and perceptual. What is the mechanism of migraine? Well, the best thinking today is summarized on the bottom of this slide, where the central nerve becomes aggravated due to overstimulation. For example, the trigeminal nerve, part of the fifth cranial nerve, can send pain signals to reverse or reduce aggravation. So if it's overstimulated, it sends the message to quiet down, put in fewer sensory stimuli, let me rest and recover. And if you look at the visual in the center of this slide, we see in the upper left a flow of electrical impulses in the brain. These electrical impulses go to pain centers in the brain stem, which should be able to filter out the important ones, or filter in the important ones and filter out the unimportant repetitive ones. And if we look at a higher level of magnification on the right, you see in pink a blood vessel, and you see outside that nerve cells sending electrical impulses to the cells that line those blood vessels. And in that case, you can overstimulate, aggravate, and irritate both the perfusion, that is the blood supply, the a supply that's bringing nutrients to the brain and removing waste from the brain. And you can have overstimulation without rest and rehabilitation of the electrical activity when the situation cycles or when there isn't an appropriate inhibitor because you've pushed beyond the adaptive limits of that individual. Now let's look at a model of migraine. This is a contemporary model published in Scientific American, the complex neurological chain reaction that leads to migraines. Well, first at the upper left, we see ion channels. These send arrows to cortical spreading depression. That is what we saw before in that functional MRI. Also sends and alters signals to the cell clusters in the midbrain and brainstem that can then create an aura and other strange migraine symptoms. The trigeminal nerve has been focused on, as we did in the last figure, because when it's overstimulated and aggravated, blood vessels lose their ability to properly open and close. There is a swelling of those blood vessels. There's a decrease in the proper perfusion. There is an increase in extracellular fluid. And the consequence of all of that in the bottom diamond is pain. Now, we, of course, rethink these issues. And on the next slide, I'm going to suggest the physiologic rethinking of the causes of migraine, and that we can understand these mysterious ion channels from a physiologic point of view, as we have in the Alkaline Way. Now, what are the ion channel disruptors? Well, first, there's metabolic acidosis. Second, there's hormone disruptors. Third, there are digestive remnants that immunologically disrupt the ion channels. And then there are delayed allergies that also can disrupt ion channels. And if we look at these ion channels, metabolic acidosis really means a deficiency of magnesium and potassium and other similar minerals, a deficiency of the essential minerals that we have to take in that we can't make in our body. And the other characteristic of metabolic acidosis is a relative excess of calcium and sodium outside the cells, even as there is a deficiency of magnesium and potassium inside the cells. What this means is that the water that binds the sodium and the calcium that accumulate outside and the lack of minerals inside the cell can alter the flow of minerals and ions into and out of the cell. And that's what is meant by these ion channels and other neurologic functions being altered in some mysterious way. But as a physiologist, we would suggest metabolic acidosis, deficiency of good minerals, relative excess of other minerals. And that in addition to metabolic acidosis, there are hormone imbalances and hormone disruptors, including environmental compounds, digestive remnants, and delayed allergies that all alter the receptor, the channel, the ion channel, and therefore can precipitate the migraine state. There are medications and conventional treatment for migraine, and this includes the triptan family of serotonin receptor agonists and the ergotamines, neuroreceptor modulators. They do have a number of side effects that many patients find problematic. There's an increase in ulcer risk, and GI and digestive problems, and indeed medication overuse itself is linked to chronic headaches of a variety of kinds. So while there are conventional medication treatments in the triptan and ergotamine classes, these are our last rather than first choices in therapy, given that we prefer to go to the cause rather than to the symptomatic consequence. And these medications are symptom treatments rather than addressing the causes. So let's look at the integrative treatments. What is the toolkit? What are the options that we have available in integrative treatments? First, let's look at the triggers. Let's look at and see if we can find delayed allergy responses that provoke the migraines and substitute for those reactive substances. Indeed, in a few slides, we'll be talking about important research work on migraine headaches that showed an important relationship between individually acquired delayed hypersensitivity, delayed allergies, late phase allergic responses, and the trigger of migraines. The second bullet on herbs shows that both butterbur and feverfew have been studied and found to be helpful. and for the right patient, in combination with other nutritional and attitudinal therapies, can be extremely helpful. Nutrients are also important. We mentioned magnesium deficiency, so individually addressing the need for magnesium mineral and B complex, particularly vitamin B2, and cofactors like coenzyme Q10 and ascorbate to set the redox potential and to know how much of that antioxidant is needed. And finally, a whole foods-based alkaline way diet that is nutrient rich and therefore helps support the many factors and cofactors the body needs for health and well-being. In addition to addressing delayed allergy triggers, herbs, and nutrients, acupuncture and biofeedback for some individuals is extremely helpful, and movement therapy, yoga, particularly Hatha Prana yoga, where you link breathing with stretching and exercises. Tai Chi, again, a system that links stretching and moving every part of the body along with repetitive breathing in order to enhance the functionality and the rhythm of the body. Pilates, Traeger technique, Feldenkrais, Alexander. These are all specialized movement techniques that for some patients are extremely helpful and that we recommend. So in regard to integrative treatments, we want to first look at the delayed allergy triggers and substitute for those substances. Second, we want to look at natural compounds like herbs. Third, we want to look at nutrients so that the individual has what they require, what they need to meet their needs. Then we want to see if acupuncture and biofeedback can be helpful. And then we want to see if movement from yoga and Tai Chi to Pilates, Traeger, Feldenkrais, and Alexander can be helpful. What about the immune system and inflammation links to migraines? Well, these are very important links that help give us insight both into the causes and into the management of migraines. So there are cytokines, there are chemical molecules derived from essential fats, and in patients with migraines, the pro-inflammatory cytokines dominate. These high levels of cytokines overstimulate the trigeminal nerve, that fifth cranial nerve. IL-1 beta is increased, interleukin-1 beta is increased, TNF, tumor necrosis factor alpha, is increased, PGE2, derived from arachidonic acid and omega-6 fatty acid, is increased. So here, migraines, in part, are favored by an excess of omega-6 fats in the diet, whereas omega-3 fats in the diet reduce the chance that migraines will express themselves. Food and environmental sensitivities are very important. I mentioned before about delayed allergies. Well, LRA by ELISA Act tests identify individual triggers. And when used in conjunction with a health appraisal questionnaire, an HAQ for individual needs, and PERC full disclosure nutritives to make sure that no allergens are sneaking in unidentified into that individual, become a basis for a comprehensive and proactive approach to migraines. Now, what is the evidence that this approach is important, and how pervasive is the rethinking that we're able to do? Well, in regard to inflammation and rethinking inflammation as repair deficit, we find that inflammation, really a lack of repair, as is seen in the center of this slide, becomes a major obstacle to recovery. And if you start from the top, you see cardiovascular diseases linked, diabetes, type 2 particularly, Alzheimer's early senility, arthritis, autoimmune diseases other than the arthritides, neurological diseases, pulmonary diseases, and even cancer have important links to inflammation. The less inflammation, the more ability to repair, the less risk of these conditions, and the more inflammation or the more deficit in repairing, the greater the risk of any and all of these conditions, so they often occur together. And so when you find one, be concerned about the others. Now let's review briefly healthy immune responses. When our immune system is healthy and resilient, we have no allergies and we're tolerant. Our immune system is able to neutralize infections and allergens that do get in. These are autophagocytosed, that is, they're brought into the cells that put them into a recycling center called a lysosome, break the agent, the foreign material, infectious or not, into building blocks, use those amino acids, fats, and carbohydrates and cofactors to build up the cell without any infection risk, without any need for delayed allergy responses. So healthy immune responses repair us from daily damage and wear and tear, and healthy immune responses delete cancer cells. So white blood cells recycle pathogens. They also neutralize potentially infectious or allergenic materials, but more importantly, they repair us from daily wear and tear, and they delete cancer cells. They do these important functions only after defense is completed. So if we have invasion after invasion of the body, meal after meal or day after day, so that the immune system is preoccupied with trying to complete defense work, never quite gets to the repair or the deletion of cancer cells, our risk has gone up and our healthfulness has gone down. Now, an overloaded immune system is linked very directly. In fact, an overloaded immune system is the cause of most chronic illness. And in regard to migraines, the work that I'll be talking about in a few minutes by Eggers and colleagues shows very clearly that at least 88% of migraines are related to a relatively small number of foods that were very carefully tested as trigger substances. And it does vary from individual to individual. So while there is inflammation and repair deficits, there will be pain and swelling as the body tries to repair but is unable to complete the repair. So chronic, degenerative, and autoimmune illnesses occur when the immune system is overloaded on a regular basis. And on this, as in most of the slides, you have a reference either to our work or other colleagues so that you can dig more deeply into the subject or dive more deeply into the subject at your pleasure and leisure. Now, what about the evidence that I mentioned that migraines are triggered by delayed allergy? And indeed, Professor Egger and his colleagues asked the question, is migraine food allergy? And they answered it in Lancet back in 1983. That's 20 years ago. They showed that 93% of 88 children with severe frequent migraine recovered, had complete remission when oligoantigenic diets were used. That is, diets where they weren't exposed to the things that they reacted against. Similarly, 90% of these people relapsed when the causative foods were sequentially reintroduced. So the role of foods in provoking migraine was established by a double-blind controlled trial in 40 children. So they went beyond the open trial of the 88 into a double-blind controlled trial of 40 children, and they found essentially the same results. Now, in regard to Egger and colleagues' work, in the delayed allergy common triggers include cow's milk in 39%, chocolate 37%, about the same amount reacted to benzoic acid preservative, eggs almost the same, 36%, wheat 31%, citrus fruits 30%, coffee 24%, fish 22%, corn 17%, and grapes the same. Now you might think, gee, what if we had people just avoid these top 10 triggers? Would we be able to avoid the testing? And the answer is no, people are individuals. Uncommon things happen to individuals that for them are important. And that's why delayed allergy testing is so critical to achieve successful outcomes in migraine sufferers. So now let's look at migraine in the physiology first alkaline way. When we have delayed allergies, tolerance has been lost. There's a hospitable host that's overloaded with foreign reactive antigens. As I said before, and may say again, infectious and non-infectious materials are treated equally by the body, by the immune defense and repair system, the IDRS. And just to review, again, some decades ago, Gell and Coombs identified 4 different kinds of allergy. Type 1, seen in red, is the immediate, the acute, the histaminic, the one we're more familiar with. And then there are types 2, 3, and 4, humoral or antibody-delayed allergy. And here, it's only the harmful, not the helpful antibodies that are a problem. So you must have a functional test to distinguish helpful from harmful humoral antibodies. It would also be nice to know about immune complexes and T cell or direct cell mediated responses. So we thought it would be useful to have an ex vivo mixed cell culture that allowed us to look at types 2, 3, and 4 delayed allergies concurrently and on an individualized basis. So we want to stop the burden to enhance the immune system. And indeed, allergens provoke symptoms, especially when repair is deferred, because defense has to come before repair. And if we become hospitable hosts to pathogens, it's a sign that our immune system is weakening, that it's not fully repairing us, that it's probably not doing its cancer surveillance function adequately, and that it is increasing the chance or the risk that we'll develop self-attacking or autoimmune conditions. The answer is LRA by ELISA ACT tests, functional tests to identify the causes of immune burdens, an ex vivo procedure that allows cells to react just as they do in the body, and to give us information about all these delayed pathways, the harmful, not helpful antibodies, the immune complexes, and also the direct T cell responses. Now here's a case example. This is a 54-year-old woman diagnosed at age 40, so she's had migraines for 14 years. Her symptoms include intense headaches, recurring every week, occurring for 2 to 3 days, including vomiting and severe back pain. The initial treatment was hormone therapy and detox protocols without relief. And then the LRA by ELISA ACT test was done. The individual had 11 reactions, including sugars, benzene, petroleum byproduct and solvents, chicken orange, cottonseed oil, black pepper, and boysenberry. So for this individual, some relatively unusual items were detected. And any one or a combination of these can trigger the problem. Now the implementation plan was to reduce the immune burden by substituting for reactive items. You substitute carefully for 6 months for the strong reactors, 3 months for the moderate reactors, so that the body can repair itself. It can overcome the repair deficit. It can fully repair after repair has been deferred, and reset the immune system after that repair is completed, reset the immune system to a healthy, tolerant, resilient, non-reactive state. So moderate reactions we substitute carefully for 3 months, strong reactions for 6 months. An important footnote: if you had to avoid everything 100% of the time to get the results, it would require a kind of perfection that humans just are not akin to. What we have found is that if you do your best, you can lower the burden to the point where the body can handle the remaining small amount of foreign material you get exposed to. But your brain and body are connected, so we want you to know that you're doing the right things. We want you to do the right things to the best of your ability, and then go by results. In this case, based on the Health Appraisal Questionnaire, the HAQ, the individual needed PERK Potency Guard and PERK Pain Guard Forte to beat inflammation and promote repair. She also needed PERK EnduraPack Guard Recycled Glutamine to repair the gut, and PERK Digestigard Forte to repopulate the gut with healthy probiotic flora and organisms. She benefited from PERK LifeGuard, the comprehensive multi-capsules family, a new generation of super multis with 40 active ingredients and with a double-blind placebo-controlled trial showing 100% bioavailability and uptake. And finally, PERK Mag Plus Guard and PERK Choline Citrate. She had a block to magnesium uptake, as do many millions of people. And the combination of PERK Mag Plus Guard and PERK Choline Citrate were able to facilitate the uptake of magnesium while also rebuilding choline and citrate stores to help communication and energy inside the body. So these mostly proprietary and patented formulas are available. The Alkaline Way guidance towards health for life is the approach that we're recommending That's first-line care for migraine and other similar conditions. And what was the result? Well, the outcome was that she had no major headache until 3 weeks after the testing, and it was triggered by a reactive item that in retrospect she was able to identify. And when adhering to the diet and the lifestyle modifications, the headaches were about 1 in 4 months and less intense. Systematic substitution, the Alkaline Way, and optimized nutritional supplements allowed repair and restoration of vasomotor tolerance. Vaso as in blood vessel, motor as in cells that move or contract, because it turns out that the endothelial cells that line blood vessels are reactive in a vasomotor tolerant way to the input chemical and electrical signals they receive, and when too much is received too often, they become irritated and predisposed towards a migraine state. With regard to the lymphocyte response assay, the LRA, a 1 ounce, just 30 cc blood sample can be used now for up to 490 LRA ex vivo tests. The widest number of foods, additives, and preservatives, environmental chemicals, toxic minerals, medications, mold, danders, hair, and feathers, and herbs of any laboratory anywhere can all be measured quantitatively by the LRA by ELISA Act ex vivo delayed allergy test. The therapeutic challenge is to identify and substitute and to know what are the items that really are the reactive triggers. LRA by ELISA Act identifies the substances that burden the immune system in a comprehensive way, and we then recommend substitution to restore digestive tolerance, to rebuild and repair, to reset the immune system to tolerance by avoiding the strong reactors for 6 months and the moderate reactors for 3 at least. The lymphocyte response assay LRA by ELISA Act is ex vivo. These cells react in the laboratory just as they do in the body, so that gives us a window on how the body is reacting. They're accurate with variance of less than 3% day to day with different readers. They're functional, that is, they distinguish helpful from harmful antibodies and other constituents. They're comprehensive in that they measure functional antibodies and immune complexes and cell-mediated responses, and they have proven clinical outcomes. So if you want to find the causes of all delayed allergies, if you want accurate and comprehensive delayed allergy tests, we recommend LRA by ELISA Act tests as part of the Physiology first approach to conditions like migraine. To briefly describe the assay, the lymphocyte response assay by ELISA Act is done on whole blood. So the whole blood is taken into vacutainer tubes, sent to the laboratory, where 28 or so cc's that have been taken properly and are kept cold, that is kept between 4 and 10 degrees in transit so that the cells are kind of in suspended animation as they get to the lab. The lab then gently spins to separate the sample in the lab. The red cells are removed, and the cell or lymphocyte-rich plasma, the patient's own plasma, becomes the incubation medium. The patient's own lymphocytes, platelets, macrophages, antigen-presenting cells are all present in a novel 40 microliters per well of a microtiter plate. Think of this as a series of dishes. Each one is coated with a different substance. That's then put in an incubator, brought back up to near body temperature, 35 plus or minus 1 degree C, for 3 hours. And then the technician is able to read these results over the next hour or so. The lymphocyte responses to antigen stimulation is measured and compared to internal and external controls. Every patient has a negative and positive control. So every patient is able to show us that there are not pre-reactive cells contaminating the negative control, nor and the patient is able to respond so that the positive control shows reactivity in those cells. The results are clear between non-reactive and reactive cells. This is how we have been looking at it under the microscope. You actually see the cells on the left, but they're non-reactive, and on the right, the cells have swollen, they've pushed the plasma away. There's a ring, a kind of halo around the cells that show reactivity. We've had a number of outcome studies, and while we have many anecdotes as well as the Egger study in research to rely upon. ELISA Act Biotechnologies has also done an outcome study in fibromyalgia, a novel treatment for fibromyalgia that improves clinical outcomes in a community-based study published in the Journal of Musculoskeletal Pain, premier fibromyalgia journals, and we were able to show in just 6 months a 50% lessening of pain, a 70% less depression, 50% more energy, 30% less stiffness in a group of treatment failure fibromyalgia sufferers. Diabetes is another area where we've had the privilege of doing outcome studies, and you can think of diabetes as tolerance loss. That is, the immune system has become reactive. There's an association with foreign antigen exposures, and we were able to show in both the type 2 diabetics and the type 1 diabetics superior results. Starting from best standard of care, we were able to achieve a 13% reduction in hemoglobin A1C in type 2 and a 46% reduction in type 1 diabetics in just 6 months, and an 18% reduction in insulin in type 2 diabetics. Type 2 diabetics were able to be more efficient about their use and production of endogenous insulin by about 18%. We now have over 50,000 cases in the LRA by ELISA Act database and a number of patient and practitioner testimonials, and we're eager to do the kinds of studies that we've been able to do in fibromyalgia and diabetes in all of the conditions associated with delayed hypersensitivity. We spoke before about the important link of inflammation, which is really lack of repair, as an obstacle to recovery, particularly in neurologic conditions like migraines. And here, we'd like to summarize the Alkaline Way, evoking human healing responses. We want to remove obstacles to recovery. We want to evoke the ability to heal in systematic and predictive ways for each individual. And we have summarized and synthesized this into a WellGuard program that uses this physiology-first approach to restore competences, restore digestive competence, detoxification competence, immune, neurohormonal, and digestive overall competence, as well as attitudinal competence, so that the immune, neurohormonal balance, and digestive and detoxification systems are all restored, renewed, and resilient. Now, what about this approach? Step 1, Step 2, Step 3. Step 1, determine the client's status via an online or paper health appraisal questionnaire, the HAQ. Step 2, employ LRA by ELISA Act tests to find hidden allergens, and if it's a recent or uncomplicated case, do basic tests. If it's a long-standing, multiple treatment failure, or complex case, then we suggest the comprehensive or comprehensive enhanced tests, LRA by ELISA Act, that are available. And Step 3, a personal perk supplementation program comes together under the Alkaline Way, comes together under the physiology-first approach. And to some, we want you to eat what you can digest, assimilate, and eliminate within healthy homeostasis, within healthy feedback and restoration of tolerance, including immune tolerance. In essence, an Alkaline Way diet saves lives. It also saves resources because it avoids or reverses dispositions to chronic and expensive other conditions. So in regard to the immune system, we want to enhance function and stop the burdens. We want people to no longer be hospitable hosts to pathogens. We no longer want allergens that provoke symptoms. We no longer want to repair and have an incomplete deferred repair. We want the LRA by ELISA Act tests to provide functional information to identify the causes of immune overload so that the immune system can be restored to resilient tolerance, delayed allergens can be identified and substituted, and the body can be facilitated in its repair through this comprehensive Alkaline Way approach. So the Alkaline Way benefits are to neutralize excess cell acids to sustain health, restore digestive and immune system competence and resilience, and to regain tolerance to immune reactivities so that the body isn't diverting itself, its energy and its attention into delayed reactions it's able to regain and restore that information for health and vitality. Metabolic acidosis is an important issue, and it can be assessed non-invasively with the first morning urine pH. We've talked extensively about this in other webinars, but to summarize briefly, the morning urine pH after rest. After 6 hours of rest, the urine equilibrates with the bladder and cells so that we have a non-invasive measure of what's going on inside the cells. The green zone is the healthy repair restore zone. That means a first morning after rest urine pH of 6.5 to 7.5. And as a logarithmic scale, the further down or up you are from that healthy range, significantly worse off you are. So if you are below 6.5, excess acid wears you out. If you're greater than 7.5, catabolic illness tears you down. So you want to be in the green healthy zone, 6.5 to 7.5. You don't want to be tearing yourself down with catabolic illness, and you don't want to be wearing yourself out with metabolic acidosis. We recommend the following kind of tracking chart, a per pH level tracking chart, where a person indicates the date, the time, the pH level, and how they feel on a 1 to 10 or 1 to 100 scale. And very often they will come in and tell you, gee, it's the days when I'm more acid in that first morning urine after rest, those are the days when I'm more pessimistic, I have trouble getting through the day, and I'm more symptomatic. And in contrast, the days when I'm in that 6.5 to 7.5 healthy zone, I'm more optimistic, I have more resilience, I'm able to get more done, I'm more productive. When people make this discovery and bring it into you, it's highly valuable, it's highly motivating, and I think it explains why we get such good understanding and compliance with the people we work with. So with regard to this first morning urine pH test, there are special papers that change color. The Hydrion test paper with a range of 5.5 to 8 is what we recommend. And after 6 hours or more of rest, you can wet 2 to 3 inches of the strip with a test tape and see what the results are. If you're too acid, the tape will stay yellow. If you're healthy, it'll turn green. If you're too alkaline, it'll turn blue. Please see the Joy of Food, the Alkaline Way Guide for further information. Then there are food and chemical effects on the body. Foods that make us more alkaline, foods that make us more acidic. This table is available at the perk.com website. And we've done webinars on the subject of eating healthy the alkaline way. Now, there are biomarkers of health and risk, and you may want to use these to show people that they have a need in case they doubt it. With regard to inflammation and repair deficit, the biomarker is high sensitivity C-reactive protein, and it should be less than 0.5. Detoxification methylation are measured by homocysteine, and it should be less than 6 micromoles per liter. Oxidation and antioxidant status are measurable by oxidized HDL, LDL, and 8-oxoguanine, and they should be near undetectable. Sugar, insulin, and energy, hemoglobin A1C should be less than 6. Acid alkaline metabolic status is measurable by that first urine after rest and should be in the healthy 6.5 to 7.5 range. So the alkaline way is a way to evoke human healing responses. We highly recommend this, especially with regard to migraine health, migraine headaches and health. And to paraphrase Hippocrates, Galen, Huang Ti, and the World Health Organization, health is more than the absence of disease. Health is the fullest expression, physical, mental, and spiritual, attainable by each individual.